Hi, I'm Dr. Lineback, and I'm going to talk today about sleep apnea. Do you snore, or are you tired or sleeping during the day despite sleeping all night? Have people told you that you hold your breath while you sleep? This could mean that you have a common disorder called sleep apnea, or OSA. OSA, in sleep, the muscles of the throat relax and the tongue falls back, causing a slight narrowing of the upper airway. When someone suffers from OSA or sleep apnea, this narrowing is excessive and results in either partial or complete closure of the airway. When air moves in and out of an excessively narrow airway, it vibrates the roof of the mouth or soft palate and the uvula, the small flap in the back of the throat. These vibrations cause the noise of snoring. When the airway becomes blocked, it is known as apnea, or not breathing. This is a temporary situation because when air does not get in the lungs and oxygen levels drop, there's a short awakening which is necessary to start breathing again. Because the cycle of not breathing, low oxygen, and waking up repeats itself several times an hour, it results in daytime fatigue and sleepiness. Also, the combination of frequent sleep disturbances and lack of oxygen have several poor health consequences. Here are some symptoms of having obstructive sleep apnea, or OSA. Snoring, daytime tiredness and sleepiness, frequent urination at night, gasping for air, morning headaches, not feeling rested in the morning, and concentration problems. If you have some of these symptoms, what to do? And you worry that you might have obstructive sleep apnea, please contact your healthcare provider, who then may send you to have a sleep study. Your blood oxygen levels, your breathing, and sometimes your sleep-wake cycles are measured either by a portable take-home device or at a sleep lab where you spend the night. There are multiple treatments for sleep apnea. If it is determined that you have sleep apnea, you may be offered one of the following options. The first and most important are lifestyle changes. Things like weight loss, avoiding alcohol close to bedtime, quitting smoking. Other options are things called positive airway pressure, which are called CPAP or BiPAP, which is a small machine that generates air to open the airway, preventing it from being blocked. Also, small oral appliances for milder cases. And then lastly, in some patients, we'll consider surgical evaluation by ear, nose, and throat specialists. There are a few surgical procedures that can be helpful, but are reserved for those who cannot tolerate the medical devices. So what happens if you don't treat obstructive sleep apnea? Complications of untreated obstructive sleep apnea include high blood pressure, heart failure, heart attacks, stroke, weight gain, diabetes, memory disturbances, depression, and anxiety. So it's important to know the signs and symptoms of sleep apnea.